So many people ask me, what do you do to your skin, Chantal? Well, first of all, what I want to let everybody know is that I will never come on to this video and explain to you all these different procedures unless I've experienced them myself. Some of these treatments I love, and some of them, they might be a little spicy or a little bit, I don't like using the word painful, but they do have great results. Recently, as you can see from this video, I did what's called a halo treatment. A halo treatment is a laser, and it is a laser that addresses things such as pigmentation, fine lines and wrinkles, pore size, texture, and an overall regeneration. My name is Chantal Ward, and I'm a registered nurse specializing in medical aesthetics. I'm here today to give you all the information that you need so that you can make sound decisions in your anti-aging journey. The reason why I chose to have the halo treatment was, first of all, I wanted to experience it, but also at the end of the summer, I've spent time at the cottage, I've been sun exposed, I'm a year older, and I really wanted to kind of get a refresh on my skin. As you know, I do a lot of other types of treatments that do skin lifting, I do a lot of skincare, but I just needed that little surface boost to really rejuvenate and regenerate the top layer of my skin. The reason why I chose to do Halo versus my CO2 is that I really couldn't afford more downtime than 3 to 4 days. Whereas the fractionated CO2 is really meant for somebody who has a little more time for downtime, maybe 7 to 10 days, and they have more skin concerns such as deep wrinkling, acne scars, surgical scars, or really deep pigmentation. For me, it was more of, let's get something done that I don't have a lot of downtime and I can be back at it within a couple days. As you can see from this video, I've got goggles on, there's this wand that's running back and forth on my skin, and it's laying down what we call these little micro thermal treatment zones. And for me, it felt like these little prickly little spiciness on the top layer of my skin. There's 2 wavelengths that are being delivered. There's a 2940 that loves water, and it actually creates that thermal injury from the top of the skin underneath. The 1470 is what we call a non-ablative laser, and all the thermal injury is happening below. So it doesn't bypass the top layer or it doesn't vaporize, but it actually creates the injury below. So if you can envision this, you've got this ablative laser and this thermal laser that is kind of creating the best thermal event or a thermal reaction. The concept of creating that thermal injury starts what's called a wound healing cascade. That wound healing cascade brings in these macrophages to start rebuilding what we've just injured. So immediately after the treatment, you can see my picture, I'm red and I'm hot. During the procedure, like I said, very tolerable. We put numbing cream on first. Yeah, I can feel the little prickliness, but at the end of the treatment, my face is super hot. The clinic where I am, we actually used what's called a Zimmer, which is a cold air machine that helps blow cold air to drop that thermal temperature of your skin. That lasted for about 45 minutes. At around the 45-minute time frame, that heat started to diminish. As you can see from my day after treatment, I now look like I'm super red and almost like I've spent too much time in the sun. And you can see the blotchiness coming up to the surface. Okay, this is day 1 after my Halo Pro. You can see that I'm starting to get these little mends come up to the surface. It's pushing all the pigmentation up as well as stimulating collagen. I am a little bit swollen, which is very, very normal. I just woke up, so laying with your head flat, as the day goes on, that inflammation will go down, but this is progressing quite nicely. You can actually see what we call these little mends. They're those little, if you focus in, those little microscopic, almost like coffee ground. That's very normal because that is pushing from those thermal injury from the ablative and the non-ablative, actually throw that tissue up to the surface to turn over and slough off. Underneath the skin, you can actually feel as that skin turn over and the flaking off starts to occur, you've got fresh, new, very soft skin underneath. Now, by day 3, it's getting way better. My skin got really dry, but I kept putting moisturizer on it. We use specific creams such as exosomes to expedite or enhance the healing process, and we moisturize. Moisturization is key, otherwise you get really itchy. Some people will have this urge to exfoliate, but you don't ever want to do that. You want the skin to turn over on its own. So when you're going through that day 3 or day 4 itchiness, just apply more moisture. Well, today it's actually day 6. Tomorrow will be day 7. And if you zoom into my skin, you can notice there's not a lot of crustiness left over, or that mends, that coffee ground. My skin is feeling quite soft, and anything that I put on actually is absorbing amazingly. So as you can see from my journey with the halo, I call it a social downtime. I'll look really red for 2 to 3 days. By day 3, day 4, I look a little tanned, but if you come up close, you can actually see it looks like I've put my face in a screen door where you've got these little dots. But that goes away, but you have to get pretty close to see that. So that's why I call it social downtime. But the results are exponential. Even though my skin has completely turned over, I'm going to continue to get that effect of that collagen stimulation and enhanced skin health over the course of the next 3 to 6 months. I love trying new things, and I truly believe Halo is a definite thumbs up. Or even any other non-ablative and ablative technology. I do work with a number of different technologies in practice, such as Clear and Brilliant, as well as fractional CO2. So as your healthcare provider specializing in medical aesthetics, when we do your consult, we'll figure out exactly which device is the right one for you, based on our desired clinical outcomes, but also for your downtime and your experience. If you have any questions or comments, please put them in the comment section below. Make sure you follow me, and I can't wait to see you next time.